Hi everyone, welcome to Health and Wellness Assessment. So Nursing 320, and it's an online course. We are in quarter three, the first half of the term, so welcome. This first lecture is going to pertain to just a little introduction from me, and then we'll go through the syllabus and some of the course, and then we will jump into chapters 1, 2, 3, and 4. So a little bit about myself. My name's Denise Pattison. I am your instructor. I've been teaching for Beckfield now, I should say, for, oh boy, 3 years, 3.5 years actually. And I have a master's, so I should start from the beginning. I got my bachelor's in nursing from the University of Cincinnati. I worked for 6 years in critical care, and I did home health and hospice. I kind of did a lot. I did it all. And then I went to graduate school at Georgetown University in DC. And part of it was online, part of it I had to go to DC a lot. And then I did my clinicals for my master's because I was focused on family nurse practitioner track. I graduated in 2014, and I've been a full-time practicing nurse practitioner in community health and public health. And I work in the primary care setting. So I know a lot about health and wellness assessments. And I actually started doing all this in undergrad. Our community class, we had to do a lot of clinical actually in health and wellness, learning about primary, secondary, and tertiary prevention. So I'm really excited about teaching this class with you guys. I work in a very busy public health primary care, mainly for adults. I do some peds. I wish I could do more. And I, of course, do gynecology in the first trimester of pregnancy. So not too much in the OB realm, lots of gen, lots of infectious disease, and then a lot of primary care. On a personal note, I live in Cincinnati. I have two beautiful kids, a 2-year-old and a 5-year-old, and a husband, and two amazing dogs. My husband's awesome. He is a great partner. So let me see if I will show you guys a picture of my family, but I don't want to go cruising on Facebook to show it to you. So I will pull it up at some point. I thought I had a picture. Let me see. I really actually am good at the computer. I don't know why I'm kind of spazzing right here for pictures. Here we go. Sorry. This is a picture of my family. So there's me, just in case you can't recognize. I actually had brushed my hair and have makeup on. That's my husband, and that's my son, and that's my daughter. All right. All right, so enough personal stuff. Let's get started with the syllabus. So if you click here, you can see the syllabus. Hold on one second. Okay, so here is our syllabus. So the course description, we're going to build on your basic knowledge of patient assessment and physical exam. So you guys obviously have that. Content is going to focus on nursing assessment and interventions aimed at promoting health and wellness. And of course, assessing individualized risk and how to reduce that. So this is really important. Sometimes there's risk based on developmental stage, environmental effects, and understanding those risks so that we can educate before that. So, you know, health and wellness, preventative medicine, what's another, community health, all that have the same themes of understanding certain populations in order to discuss where your education is going to focus. And nurses, we are just trained. And when you move on for your master's, perhaps your doctorate, I'm getting my doctorate right now, is you will learn that education is probably what we are best at as nurses. So, especially when it comes to the patient population. So you're going to learn how to complete a health and wellness assessment of a child, adult, and older adult, and incorporate health promotion and disease prevention concepts, as well as healthy behaviors and understanding when something's not a healthy behavior and what we do as nurses for that. You're going to explore the role of complementary and alternative therapy in health and wellness, which is a really cool area. So here are our course objectives. We are going to define health and wellness from a functional and behavioral perspective. We are going to obtain a family health history and identify the health risks of an individual based on their genetic history, which is actually huge now. Taking a family health history is super important when you're identifying risks. And I have my nurses do that with every new patient that comes in. Identify the age and occupational health risk of a young adult, a working adult, and an older adult. Prepare a health, behavior, and lifestyle modification plan for an adult with a risk of chronic disease, such as obesity, heart disease, or diabetes. And we're going to talk about risk behavior modification, things that we can modify within our environment. And of course, risks for chronic disease. And it's not just adults also. We will touch a little bit on children, just because now chronic illness in children is becoming, obviously not, I'm not talking about genetic chronic illness, I'm talking about preventable chronic illness is now becoming a problem that's pervasive among our children. Prepare a health, behavior, and lifestyle discuss the health belief model. Okay, so you guys are going to be like, Denise, I do not like talking about nursing theory. And I remember in undergrad being like, I don't understand any of these theories. But the health belief model is actually a really understandable and a very, what's that word? Usable, real life, it's extrapolable into real life. The health belief model is and how it impacts individual health behavior. And honestly, it is a cut and dry formula for people to understand how to change their health and their behavior and health. We're going to explore the impact of the environment, culture, and ethnic influences on an individual health behavior and risk between individual and groups. Conduct a self-assessment of health and wellness and design a plan for improved health behavior based on a risk appraisal. So this is actually really interesting and super helpful, especially for those of you who want to move onto a advanced practice area, understanding how to look at populations and understand risk appraisal, and then how to modify your care based on that. Analyze a variety of complementary and alternative modalities to improve health and wellness. So talking about massage therapy, touch therapy like Reiki, body movement, mindfulness, based stress reduction and mediation. And again, especially for those who are in case management or perhaps outpatient, understanding these alternative therapies to use adjuvantly or alone, especially when it comes to behavioral situations. So make sure that you keep I'm really excited to talk about that area with you. So our textbook, we're using Health Promotion and Nursing. It's by Mayville and Huerta. It's a 3rd edition. If you have a younger edition, just be mindful of the names of the chapters, okay? And then if there's something missing, you just have to be really weary about that sort of thing. So pay attention to lectures, and if there's anything missing that we talk about from yours, that's just kind of what happens when you're with a later edition. So either contacting the publisher or renting the book or borrowing a book from a buddy just to see if there's anything crazy missing. All right, so we're going to have lecture and discussion. Discussion comes from our forums, of course, reading. Now, on each wall, we'll talk about it, there's going to be the assigned reading and then extra reading that obviously is never going to be mandatory, but it's going to be helpful for you to understand concepts a little more. So, you know, I went through and chose them specifically for each week. So I would definitely take a gander at the reading. There's also some videos and some links that I think you're going to find helpful to kind of support what we talk about each week. Obviously, we're going to use some writing type projects, homework assignments and projects, and we'll talk about each of those to further talk about our learning. So this is full on distance. There's no clinical component. The classroom policy, just be respectful. Everybody has different opinions. We all come from different environments, so being respectful and professional. Make sure that you use professional terms for things. Don't call, like the Affordable Care Act, don't call it Obamacare. Don't call the New Care Act, New Health Care Bill, Trump Care. Call it by its formal names just for 2 reasons. One, we don't want to strike up some sort of political fight That's not the purpose of this course. And two, it just keeps things professional, so no one can infer anything from anyone's writing. And make sure that you abide by all academic policies related to attendance, so triggering on time, behavior, and then professional conduct, specifically with plagiarism. I'm really a big stickler for it. You will get an automatic 0, which means you'll fail, because zeros are just really hard to overcome. So just don't plagiarize. It's really easy not to, by following APA rules. All right, so this just discusses the breakdown of each points, and we'll go over those when I take you through the course wall. Here are the nursing core values. We don't have a lab. You don't have to worry about that. Attendance. So you have to trigger on time. You have to trigger Thursday by 11:59 p.m. If you don't, you're considered absent for the week. Now, you'll turn in part of your, you'll still turn in your discussion board. You'll lose points for lateness, but you'll still get points. But if you're absent, I think more than 2 weeks in a row, just because you triggered like 5 minutes late, there's nothing I can do about that. You've triggered late, that's it. You get kicked out of the course because it's an 8-week course. So just make sure you trigger on time. I tell students sometimes to just trigger early and then repost something better. I mean, however you need to do it. But the triggering rule is something I cannot override. It's just a school policy and with our accreditation. Eligibility of makeup work, and that is just up to my discretion, pretty much extenuating circumstances. I need to be aware of stuff. I no longer do this anymore because it is not cool. We are all adults. You have to figure out what work you're missing, and you need to let me know and ask me if there's going to be a possibility to make up the work for less credit, or if this is kind of a deal breaker because you missed the work. So if we're on week 8 or week 6 and you realize you missed 2 huge assignments, that's going to be your responsibility. And for the most part, I don't let people make things up unless there's an extenuating circumstance, and I usually ask for proof, just because it's not fair to your other classmates. If they went through all 6 weeks of work and then you're making up 6 weeks of work the last week of the course, that's not fair. So keep in contact with me. I give you guys my cell to text me and my email. So there's never, ever, ever an excuse for something to be super duper late unless we've discussed it ahead of time. Academic integrity, I want you guys to read this. You guys are going to get, or you guys know all about our violations of plagiarism. I know it's hard trying to figure out when you're paraphrasing, trying to figure out when you're quoting. You need to use your APA book. I will not take ignorance as an excuse. You have access to the library and writing tutors, so there's really no excuse as to why something isn't quoted correctly. If it is not your original idea, you need to cite it, and you need to cite correctly where you get it from. If you are going to paraphrase something, you better make sure you paraphrase correctly. Paraphrasing does not mean that you just change around words. You have to reshape ideas into an original thought. And then with quotations, make sure you quote correctly. And so follow APA guidelines for that. So a lot of people depend on Purdue, and I'll say that that is very basic on how to quote and cite within the text and how to reference. And I go by the APA book because that's the correct way to do APA, especially for those of you who want to move on to your master's. If you cannot write proper APA format, you won't be able to get into a master's program or pass a master's program. So I'm preparing you guys to get your bachelor's. If you have a question on APA, we can set aside a time for tutoring. I always do that with my students. But you can't just email me and say, I don't get it. You have to meet with me. But I really recommend you guys meet with the online tutors because that's all they do all day. And if I catch any copy and pasting, hyperlinks, plagiarism, it's automatically a 0 on the paper. Just because you shouldn't be copying and pasting anything onto your paper. Even if you're going to go back and quote it later, you need to type it out and quote it. And I know that might sound weird, but I mean, I find hyperlinks all the time on papers, and it's really discouraging and rude and unprofessional. So make sure you keep your eye on that. And then last but not least, you may not use a APA reference generator because they are mainly wrong. there's only a few that are out there that sometimes come out right, and that's only for journals. I'm going to tell you, most people cite their books incorrectly, for sure, websites incorrectly, for sure. PDF case files, those are all done incorrectly because people use the wrong generator. Don't use a generator, use your APA resource to write it out. If it's wrong, you're going to lose all your points on APA. And I don't give points back for APA stuff just because you have to learn how to do it. So here's the Learning Assistance Center. They are awesome at APA format, and so is the library. If you are stuck on an APA citation, they will help walk you through it, okay? So here's our week breakdown. So the first week we're going to talk about foundation and theory, and then nursing concept of health promotion, and then theory on health promotion, and then our role as nurses in health promotion. The second week we talk about how to communicate with patients, what cultural considerations we take, what environmental factors affect health, and then mind and body and spirituality. Week 3 we're going to do talk about health in adolescent, young adult, and middle-aged adult. And I will touch a little bit on peds. You're not going to be tested on it or have to write anything, but I am going to do some pediatric 0 to adolescent, just so you guys, I'm sure some of you work in peds, and it's important that you know that. And then week 4, we're going to hit the older adults, the gerontological aspects, and then health promotion through end of life. Week 5, we're going to talk about nutrition, physical activity, weight control, and then holistic approach. All right, so the next lecture, we're going to discuss a little more about the wall breakdown and each assignment, and then we will get into chapter 1.